So today we're going to talk about the 5 symptoms of concussion and post-concussion that might come from your neck, even if your neck doesn't hurt. These include dizziness, lightheadedness, nausea, fatigue, and postural instability or balance issues. Hey there, I'm Dr. Mark, and over the past 5 years I've worked almost exclusively with concussion and post-concussion, and in that time I've cleared over 500 athletes, from professional and NCAA athletes all the way to JV and varsity high school athletes, to their parents, teachers, grandparents, and everyone in between. So on this channel we talk about concussion rehab, getting over your symptoms, and how to get you back to your work, your school, your sport, or your life as safely as possible. So today we're going to talk about the 5 symptoms of concussion and post-concussion that might come from your neck, even if your neck doesn't hurt. So that's how we get the silent symptoms of whiplash, that sexy little title, breaking the fourth wall here. We're also going to talk about how the neck can pull off this sneaky little feat of uncouth behavior. And then we're going to gloss over some of the ways that we can actually assess for and treat these issues. So the 5 common but silent neck symptoms include dizziness, lightheadedness, nausea, fatigue, and postural instability or balance issues. So none of these require neck pain, and all of them also look like autonomic or blood flow issues, visual or vestibular issues, and they can even look metabolic. So how does the neck enter this conversation? For starters, we need to look at the mechanism of injury of concussion. We're talking about the G-force. So the G-force, the linear acceleration of concussion, is actually 15 to 32 times the force needed to cause cervical strain or sprain or whiplash. If you haven't seen my other content or you haven't seen posts on social media, the numbers here are whiplash can occur at around 5 Gs of force, and then concussion can occur between 60 and 160 Gs of force. And because concussion is an acceleration-deceleration injury like whiplash, your neck and whiplash are almost prerequisites for concussion. So if you want a different take on this or just more information about this, you can see my other video, How Easy Is It to Get a Concussion? We discuss concussion versus whiplash and how the symptoms are almost identical. But now that we've established the neck is usually tweaked in concussion, now what? So now you might have obvious neck pain with limited range of motion, you might have obvious neck pain and referral headaches, or your neck might feel fine, but you feel pressure building behind the eyes when you read, or you feel sort of like detached and spacey and out of it, or you feel dizzy and like disoriented when you stretch your neck, or driving as a passenger makes you nauseous. So the neck can mimic all these visual, vestibular, and autonomic symptoms because the neck is so closely tied to the visual and vestibular systems. And these are essential for maintaining balance, coordinating eye movements, making sure that you know where you're at in space, that you don't feel dizzy. So here's how they're connected. We've got sensory integration and we've got reflexes. So the neck muscles and joints and all the proprioceptors up here, the spatial awareness receptors, they provide sensory information. So I'm going up here, particularly C1, 2, and 3, those cervical vertebrae up there. They provide sensory information about the position of the head and neck back to the brain. And on the way there, that information is integrated with visual and vestibular inputs to create an understanding of where you are in space. Your visual system sees where you are, your vestibular system feels where you are, your neck feels where you are. And that all integrates to tell you, here's where I am relative to, the tiger, and the tiger is there relative to me. And there's all these reflexes that also play in. So the neck contributes to several reflexes that coordinate eye, head, and body movements. We got the vestibulo-colic reflex, the cervical-colic reflex, the cervical-ocular reflex, which ties into the vestibular-ocular reflex, and they all tie together to kind of reflexively help you maintain balance, eye movement, head and body position. And when we have dysfunction in this sensory system, it can disrupt the integration of the visual and vestibular input, leading to symptoms like dizziness, nausea, fatigue, headaches, etc. So that was a lot, but if we simplify it and zoom out, the way that I love to describe this is using a band analogy that I got from my colleague and buddy, Dr. Connor Ryan. He's a great physical therapist. So think about your eyes, your ears, and your neck all as instruments in a band. You need your visual, vestibular, and proprioceptive cervical inputs to be playing the same song, or it sounds like garbage. Practically speaking, if your eyes, your ears, and your neck aren't playing the same song, you feel like garbage. There's a constant interplay and feedback between the eyes, the ears, and the neck. So when your neck is wonky, even if it's silent, meaning not in pain, the smoke might be these visual vestibular symptoms, but the fire is actually in the neck and the information that your neck is giving to your eyes and your ears. So what can we do about it? The first thing is we need to identify it. So through a physical exam, you're going to find that exercise tolerance is usually fine. You may not have resting neck pain. So like right now I don't have neck pain, but maybe if I had this concussion injury, when we go to palpate and we go to feel, ooh, there's a tender spot. Oh, that's referring to my eye. we get tenderness through the neck and at the base of the skull. We might even find that you think your range of motion is fine, but when we test it, it's restricted in certain directions. Or it's actually normal, but you tell us it feels restricted in certain directions. That perception of stiffness might actually indicate impaired information going back to the brain. You may demonstrate gait or walking issues, particularly if we ask you to close your eyes or we give you what's called a dual task. So I say, hey, I want you to walk up and down, but you're going to say every other month of the year out loud. We might start to see you kind of falter there because you can't coordinate that proprioceptive information while you're walking and chewing gum, so to speak. We may also see impairments in joint position sense and sensory motor integration. So I've got this fun tool called neck care device, and we clip it on here, make sure it's snug, and we can see if I close my eyes, can I come back to center and how far off am I? That joint position sense. Can I do this in each direction? Can I come back to center within 0 to 4 degrees? Same thing if I throw this on and there's a dot moving across my screen. Can I pretend my nose is a laser and I'm following and shadowing that dot? How well do my visual, vestibular, and neck systems coordinate for this sensory motor integration? And what we find is after concussion and whiplash, usually not so well. And as anticlimactic as this may be, rehab and treatment are patient specific. So what do we find on the exam? What can you tolerate within a symptom threshold? And just know that it's not always isolated to fix the neck, which is kind of wonky. Because we've got this interplay between the visual and vestibular system, sometimes we have to go top down and we have to do visual or vestibular feedback to help the neck, and vice versa. A lot of times it's synergistic. And please, please, please do not accept or tolerate that rehab is simply chin tucks and kind of pressing into the base of the skull. That's not inherently bad. I still prescribe aspects of that, but it's often mistaken for complete cervical concussion rehab. It's not. You need to know how your neck orients to where you are in space. You need to get proprioception in as well as the biomechanics. So to wrap this up, the silent symptoms of dysfunction doesn't mean you don't have symptoms. It means that it's not always apparent that your neck is causing them. A quality history and physical exam with a concussion literate provider is going to be the best way to sort of untangle this mess. And if you'd like that particular conversation and exam to be with me, you can go ahead and schedule a free concussion consult at the link below or visiting my website. I appreciate you sticking around. If you learned something from this or enjoyed this video, you might also learn something from or enjoy these other videos. Until next time, I'm Dr. Mark.